All right, let's talk high level first. We know social determinants of health are incredibly important in the work that we do. That's the economic and social factors that play into a person's health and well-being. So what are we doing as a system and how are we addressing social determinants of health?
About 20% of overall health is what we do within the walls of our clinics and hospitals. 40% of overall health is based on the social determinants of health. So what do we mean by that? Food, healthy food, clean water, access to education, income opportunities, those types of things, transportation, safe environments. And so we're focused on overall health, not just healthcare. Traditionally, healthcare is focused on sick care, right? Patients get sick, they get admitted through the emergency department, we take care of them in our hospitals. We need to move upstream and get ahead of some of these disease processes before they even happen. And so that means plugging people into those appropriate community resources that can help them with whatever they're struggling with, food insecurity, housing, things like that. And then on our end, we need to focus on screening and prevention. And so it's getting people mammograms and colonoscopies and other things. It's treating some of those chronic diseases like high blood pressure and diabetes before they get out of control and someone gets sick enough to be admitted to the hospital.
So as part of our Life Inspired movement, we've had different initiatives like Inspired to Fight Hunger, Inspired to Fight for Healthy Housing. Can you talk a little bit about those things and how they really play into our goals as a system?
Yeah, so this is an area that I'm so proud of our team members. Many of them have engaged to help with some of these initiatives. For example, we had many team members go out and help pack food boxes to send out to those who are suffering from food insecurity. Even our senior leadership team engaged with Habitat for Humanity and helped to work on the house that's being built in Neenah for a very deserving family. And I know Habitat for Humanity is also working out in some of our rural communities to expand, affordable housing for deserving families in those communities. And so those are just a couple of the initiatives that we're engaged in. But again, our goal is to work on these social determinants of health because they have such a big impact on overall health, and it's completely aligned with our mission.
Okay. As a system, we embrace technology in so many different aspects. So what are we doing with technology to provide better care for our patients and our communities?
Technology can augment the things that we're doing. It's not going to replace the people, right? Our people are the most important asset that we have. But we're going to use technology so that we can take care of more people. We want to empower our team members so that they can be as effective as they can in their jobs. And so things like leveraging data and analytics, right? Let's not just throw the dart at the dartboard. Let's make a really informed decision based on the data. Robotic surgery, right? That's another example where we've invested in technology, and that means that we can do surgery on patients where they have smaller incisions, less pain, less blood loss, go home sooner, and get back to doing the things that they love to do.
We have some really exciting projects coming up in 2025, 2 new health campuses, one in Fond du Lac and one in Oshkosh. Can you tell us why those projects are important to those communities?
One of our mantras here at ThedaCare is care close to home. In Oshkosh in particular, we were very strategic about where we placed that campus. Most of the residents live on one side of I-41, and almost all of the healthcare assets are on the opposite side. And so we put a facility with an emergency department in the location where most of the residents live, because when you're having a health emergency like a stroke or a heart attack or something else, minutes matter, and we want to make it easy for patients to access us in the emergency department.
Absolutely. And in Fond du Lac, that is a smaller community hospital, and it's providing really important services for, like you said, people who really need them and are saying that we want them.
Absolutely. Over time, as the community continues to grow and we assess what the need is, we'll likely expand the services that we provide there.
Perfect. So let's look beyond 2025 here. We are launching a graduate medical education program within our system. Can you tell us what the GME program, as it's known as, what that is and why it's important to start something like that here?
Yeah, so graduate medical education is the training that physicians need after they graduate from medical school. And so if you want to be a surgeon or an obstetrician or a psychiatrist, you need training in that particular field. We're so excited about this program for many reasons. reasons. One is, in some of these specialties, there's not that many physicians, and so it's hard to recruit people to come to the Fox Cities and beyond. And so we're going to have this pipeline of physicians that we train. They're going to be here with their families, and they're going to have spouses who have employment in our community. So that creates the pipeline of new and young physicians who are going to come and serve our community. So that's really exciting. The other thing to know about graduate medical education, just like other education programs, they elevate the level of care that we're able to provide in our facilities. They ask really good questions like, why do you do it that way? And it causes our physicians to sort of pause and think and be able to explain it. And so it really helps us all be at the top of our game when we're providing healthcare to the community.
All right. Thank you so much for being with us, Dr. Cavagnol, and giving us a look into the future.
It was a pleasure. Thanks for having me.